In this video, we're going to be talking about breast augmentation with silicone implants. The most common reason why patients come to us plastic surgeons for addressing the size of the breast is for an underdeveloped breast. This could happen right from birth. It's a developmental thing, and sometimes they also have an asymmetric breast right from birth. So this is something that as plastic surgeons we address this concern by using silicone implants and enhancing the size of the breast. Most of these patients are silently suffering from a low self-confidence, low esteem, and as a plastic surgeon we can boost up their confidence by enhancing the size of the breasts. Now, what are we using for increasing the size of the breast? We use silicone implants such as these. These are 7th generation, 8th generation implants, very high quality implants which we use them for enhancing the size of the breast. And these are inert. Once they go into the body, they're inert. They don't. The body doesn't react. They're very safe to use. And coming to the safety, previously we would hear of implants rupturing, bleeding, and all kind of problems. Now you see this implant. We purposely cut this implant, and you can see the gel which is actually leaking. And once I remove the pressure, the gel gets back. So there's no gel bleed, gel leak with these 8th generation implants. They are very high quality. They have cohesive gel inside them, and which makes them very, very stable and maintain their shape. Now, what do we do for these patients? We first have a consultation with these patients. We ask them what their expectations are, and once they come up with their expectations, we know what is the dimension of their breast. Once we examine them, the first measurement which we take is the base diameter, and based on the base diameter we have various implant sizes which can go there. And assuming that, let's say, this is the base diameter which is actually suiting the patient, we help the patient in determining the volume of the breast implant which we're going to use. And not only by this estimate, we also have the external breast implant sizer. We also use softwares to determine the size of the implant in such patients. So the patient clearly knows from our consultation and from examination that this is the implant which is going into her, and that's how she's going to look. And once this is done, the outcome is supposed to be very good. The patient is going to be satisfied, and obviously the self-esteem, the confidence is going to be built up, and they can get back to their personal lives.
So breast augmentation is done under general anesthesia, and it is done as a daycare procedure where patient walks in, get the procedure done, and goes home the same day. So breast augmentation can be done in two ways. Either they can get the breast augmentation done with their own fat tissue, which is called as fat grafting, or we can use even an implant for augmenting the breast. If we are doing a breast augmentation with an implant, a cut is made under the breast, so it will be hidden. Majority of the time that is the approach. In some patients, we do an incision around their areola too, so that is also one of the approach. So when we cut through that area and we put an implant can be put under the fat pad of the breast, or it can be put under the muscle. So it depends on the skin thickness of the patient. And if it is being done by the procedure of fat grafting, we take the fat from the area of tummy or flanks where they have excess fat deposit. We use that fat, process that fat, and we inject it. So the scar would be like almost 0.5 centimeter, and that would be also under the breast, and it would be hidden.
Breast augmentation is a very safe operation to be performed. And once it's done by the right plastic surgeon and in the right hospital, having the right environment in terms of sterility, there can be nothing going wrong with these operations. And understanding is very important. Once the patient knows what the doctor can deliver, and we know what the patient wants, the expectations are met, then I think the result is very, very nice, and it can help you in gaining your confidence and gaining your self-esteem, and thereby get back to your normal routines.